I want to connect three concepts for you: COVID, school, and airplanes going down. Let's start with the last part. Airplanes going down. What happens when an airplane starts to lose oxygen or cabin pressure? Well, those oxygen masks pop out. And what do they say at the beginning of flights? They say, put on your oxygen mask first before you worry about your neighbors. And then think about for parents, especially who have like a young child, and they're thinking, well, how is my child going to save themselves? I need to think about them first. But the reason why you got to think about yourself first in an airplane that's losing cabin pressure is the exact reason why we're having trouble recognizing massive brain health changes post-COVID in school, which is that the teachers in school are struggling with brain health problems themselves, which are making it extremely hard for them to identify or recognize the massive change in neurodiversity that has transpired post-COVID. Now, why is this happening? It's for similar reasons. It has to do with air. It's not that we're lacking oxygen. It's rather that a lot of people have leftover toxins because of COVID in their bodies that's affecting and disrupting the natural order of things in terms of what their immune system is supposed to be doing. And on top of that, they're going into the same school buildings that they have always, but because schools and the White House made special pains to announce this about schools in particular having especially bad indoor air quality and announcing billions of dollars of investment to try to fix at least some public schools on that front, it compounds the pre-existing immunological response, which can convert body inflammation into inflammation of the brain that's chronic and low grade and hard to detect, but often shows up like things like ADHD, anxiety, OCD, bipolar, depression, and dyslexia, and even autism. Autistic symptoms of autism are exacerbated by chronic inflammation of the brain. So a lot of times we get caught up in, saving our kids beforehand, but we gotta, as teachers, as educators, consider our own brain health so we can see things the way they are in terms of the level of dysfunction, the processing, emotional dysfunction that, we're seeing in education today. Because really, when you think about it, there's the level of kind of like fixing learning has less to do with pedagogical realities and more to do with medical realities in a post-COVID world. More on this to come.